All right, good afternoon, everyone, and welcome to the weekly webinar. Happy first week of December. We made it in 7 days, and we've got just 24 more days for the rest of what has been a full year. And one of my favorite parts of this year has, of course, been spending time with all of you on our weekly webinars. So thank you for being here. I'll remind everyone to please mute yourself while our speaker is presenting. Feel free to use the chat feature if you have questions or comments, and our speaker will certainly, I think, be able to give us some answers before we wrap up for the day. If you need closed captioning, you can turn that on using the button at the bottom of your screen. We are recording, so this will be available later to watch again, or if you know someone who might find it helpful. And I think those are all the housekeeping notes for now. So let me introduce our speaker for today, Valerie Johnson. And she has a Master of Science degree in Dental Public Health from the University of Iowa. Valerie is also a former associate professor in the Department of Periodontics at UMKC School of Dentistry. She currently consults on oral health programs, patient care management, and does continuing education with a gerontology focus, so helping out older adults. She's a certified senior advisor. She volunteers as a community educator at the Alzheimer's Association Heart of America chapter, which is where I met Valerie some time ago. And this summer, reunited with Valerie and was so honored when she said she would come and talk on this very important topic for our webinar today. And Valerie also supports veterans and partners with lots of local community-based services. So we are really lucky to have Valerie talking about something that many of us might not have even really thought about. I don't know how often we think about whether our oral health or dental care matters to our brain health. And I know all of us think about brain health a lot because we come to these webinars, we work for the ADRC, we have a loved one who might have some memory changes. So if you haven't thought about it before today, the time is now. So with that, Valerie just nodded. Thank you for affirming that, Valerie. I will turn it over to Valerie, our speaker, with my thanks and my interest.
Thank you. Thank you, Kelly, for the opportunity to be with you all today. And thank you for including this aspect of healthcare as part of the webinar series. So we'll go ahead and kind of grab an overview here of what periodontal disease or gum disease is and its inflammatory nature upon the body, and then also how that impacts our systemic conditions, our health conditions, including our brain health. And then we will kind of cover some areas where we can reduce our risk for periodontal disease, take control of our health a little bit, and then maybe touch on some oral care considerations that might be helpful as for your own health, but maybe somebody that you are partnering with in their care. So we're going to really cover what periodontal disease is, or gum disease. What is it exactly? And so I'd like to take a really deep dive into it, and you'll all be experts by the end of this short time together. But if we look at the mouth or periodontal disease, kind of the wide angle view, we see that, of course, it is part of the digestive system, which last week, Rosie Pascalini actually talked about the gut-brain connection. And today we are going to examine the connection between the mouth and our brain-body health. That's the wide angle view. If we go really tight in, we zoom in, we're going to go to the microscopic level of what's going on in our mouths. And so let's really cover this in terms of what we see here. This is like a microscopic image of what we call bacterial dental plaque. And so today, as we're talking, I might say bacteria or plaque interchangeably, but it's basically the same thing. And bacterial plaque is constantly forming in the mouth. It forms on hard and soft surfaces. So whether it's hard surface of a tooth or a crown or a filling or an implant or dentures, that plaque is constantly forming. And it also is forming on the soft tissues, which can be the tongue, the inside of the cheeks, under the tongue, everywhere. But where it really likes to be protected and really multiply is right along the area here, which we will, basically call the gum line, and between the teeth. And that's where bacterial plaque likes to basically grow and become more detrimental to our oral health. So this bacterial plaque is really responsible for two basically preventable oral diseases that we encounter, one being cavities or decay, and the other being periodontal disease. And, we could spend all kinds of time talking about all of these, both of these diseases, but for purposes of today, we're going to really just cover periodontal disease. And so we're going to get really educated on what that is. And so periodontal disease is basically an inflammation of the periodontium. And it's a chronic infection that exists in our mouth. So I want to really focus in on this little diagram here so that you can understand what the periodontium is. The periodontium is simply the soft tissue that surrounds the tooth, as well as the hard tissue, meaning the bone that surrounds the roots of the teeth. In this diagram, you can see there's kind of like this healthy side, and then you've got the periodontal disease side. And so let's kind of dissect this really. So on the healthy side, we've got gum tissue that sits nice and high on the tooth. And then we've got this great bone that's supporting the tooth here around the root. And then if you look at the end of this blue arrow, you can see this almost like a string attached to the root of the tooth. Well, this is kind of the entry point to the canal of the tooth. If you've had a root canal, you know what I'm talking about. It's also, we call it the pulp of the tooth. But inside this little pathway, we have a connection to blood system, lymphatic, and nerve system. And so that's really the nutrient supply to the tooth. So in a healthy condition, this is what's going on. Let's say over time, the bacterial plaque is allowed to sit on this area and multiply and worsen. It will become hardened in what we call tartar or calculus. And then that tissue is going to basically inflame and create an inflammation that will even extend into the bone. And so what happens is you end up with inflamed tissue as well as bone loss. And these are a couple of indicators of periodontal disease, because in health, there's an attachment that sits about here, attaches the gum tissue to the tooth or to that area. And in disease, that starts to move down the tooth and becomes less attached and creates more of a disease state. So finally, I want to call your attention to this here, which is a periodontal probe, which is what's used in the dental office to measure the extent of disease that may be going on. So in a healthy situation, this measurement is going to be somewhere between 1 and 3 millimeters. But in a disease state, that probe is going to go deeper into a 4 or more millimeter, what we call pocket. So those are the indicators of periodontal disease. A periodontal pocket measured by a probe and the loss of bone. So gingivitis is something that we hear a lot about, and gingivitis is basically an inflammation of the gingiva or the gum tissue, and gingivitis is reversible. It might present itself as a little bit of some inflammation in the mouth. You might have a little bit of bleeding when you brush. You might, it's just a little bit angry, the tissue. And the key is there is no bone loss at that point, because all of the inflammation is basically isolated to that bit of tissue. And in that situation, you can really up your oral hygiene game and reverse it. And all will be well. But if we don't do that, then that gingivitis will become a periodontitis or periodontal disease, in which case now we're going to lose the supporting tissue and bone around the tooth. So knowing that, we can also understand that this is a chronic infection. So periodontal disease is an infection in the mouth. And some people are at greater risk for developing periodontal disease. These are just some of the conditions that place a person at higher risk for periodontal disease. But having the presence of bacterial plaque or inadequate oral hygiene plus these conditions increases a person's risk even more so. So basically, periodontal disease is that inflammation surrounding the tooth. And then it's also what is going to cause the immune system to be in this chronic fight to protect the body from infection or from this chronic inflammation. And so kind of an analogy, if you take the tissue from the mouth and you had a mild case of periodontal disease, it might take up the size of a postage stamp, if you will. If you had a really severe case of periodontal disease, it might take up the inflammation the size of maybe half a postcard. And so in research, I just wanted to point out that the researchers are trying to quantify this measurement, if you will. But just for our purposes, we can think postage stamp for a mild case up to half a postcard. That's a lot of skin. The problem with it is that we don't see it because it's in the mouth. We can have that much inflammation going on in the mouth, but we don't see it. If we took that amount of inflammation, open infection, and we put it in a place that was visible on our body, then we would get really concerned about that. We would be trying to figure out, how am I going to heal this? How am I going to treat it? And how do I keep it from getting further infected and maybe creating a major problem with my health? So again, this is the challenge with periodontal disease. We don't see it. And so periodontal disease, as you now know, being a chronic infection and having an impact on our immune system, we can see that it has some association with some health conditions, including what we are learning about Alzheimer's disease. So generally, bacteria of periodontal disease, we already know that when it gets into the blood system, it can create problems like infective endocarditis for a person who's at high risk, which is basically an inflammation of the endocardium, which is of the heart. And then some high-risk individuals who have prosthetic joints, hip replacement, knee replacement, they can be at greater risk for problems in those joints. And then we also know that individuals who might be undergoing a transplant surgery, they can also need to be further evaluated before that surgery to make sure that their oral condition is not in a diseased state. So preparation for a very important procedure. Other research has been done in the area of bacteria with respiratory illnesses, and that could be chronic bronchitis or acute pneumonia. Very much aspiration pneumonia is another area that has been studied for high-risk individuals, especially. That's a major concern. And of course, during COVID, there were some research studies going on as well about outcomes, people who were not periodontally healthy and how they recovered from COVID, or how detrimental their COVID status was. And then also cardiovascular disease and stroke has been connected to bacteria from the mouth from periodontal disease. And in an injured blood vessel, there can be kind of the precipitation of a blood clot from these bacteria, which can lead to heart attack and stroke. And finally, diabetes is a whole nother area of research study where we see that blood glucose control metabolism can be affected by, an active periodontal infection. It really does have an impact on our body. We know that. And now the research is showing us that there is a connection, we believe, with the bacteria of periodontal disease and Alzheimer's. And while we know that it's not a causal link, and that would take some really special research to determine that, we are seeing the research show that there are relationships and associations with Alzheimer's disease and its impact upon the body and brain health. So this bacteria has been studied, and these are just some of the main players that we've seen a lot about. One of them being the Porphyromonas gingivalis, P-Ging for short. That's been actually noted as a keystone pathogen because it does definitely play an important role in periodontal disease, but is also being detected in parts of the body, particularly as it relates to Alzheimer's and neurodegenerative diseases. So a lot of study with P-Ging. And then there are the Treponema species, which we know can be connected to amyloid, which we always hear a lot about, as well as Fusobacterium nucleatum and its beta amyloid and Tau connection. And then the last one I just threw up there for the researchers in the room who like to say these crazy words, but I won't. And they are connected as well to some pro-inflammatory cytokines, which of course affects our immune system, triggers our immune system, activates all kinds of things. So we have some research about how these bacteria play a role, and there's continuing to be more research about that. So knowing that these bacteria do exist in periodontal disease, and how can we reduce this risk for periodontal disease? I think you already know now that bacterial plaque is really the main player in this. And so it's really important that we go after the oral hygiene that we have, and then of course getting regular professional care to reduce that risk as well. So by minimizing the source of bacteria in the mouth, which is just a local control, then we can try to minimize the source of bacteria that is present in the body systemically. So how do we do that? And the good news is there is nothing new under the sun in this area. It is just basic, good daily oral hygiene, and brushing is most important. When we look at the bacterial plaque in the mouth, it's very sticky. It needs to be mechanically removed. It cannot be rinsed away. So a brush and floss are really what's going to disrupt that bacterial film. And basic brushing, there's nothing fancy to it, really. And it's most important that it's being done thoroughly. It's not so much how many times a day, but if you're doing it really well, even once a day, that will suffice to just keep that bacteria from getting more layered and more organized, and the bacteria from multiplying. So basic brushing. What kind of brush? A good soft toothbrush, doesn't have to be fancy. They got all kinds out there now. So if you've gone to buy a toothbrush, it's a major decision. But what's really important is I add this because here's a toothbrush in good shape, and here's one that started to wear out. So, once you start to see those bristles kind of fray and splay, then it's really time to replace it so that you can be more effective with your brushing. So that's certainly my takeaway point on toothbrushes. Electric toothbrushes are great, especially if dexterity is a problem or a concern. And then here are some floss options, right? So you've got your regular floss, and then you've seen these everywhere in the stores, the floss pick holders, whatever it is. So, a lot of people ask me what's the best kind of floss to use, waxed, unwaxed, slippery, not slippery, whatever they're calling it. You want to basically use the floss that is going to work for you. So that's the important thing. So anything that's going to clean between the teeth, because as we saw earlier, that plaque likes to hang out between the teeth, and that's where it can create a problem for our gum tissue and our supporting, supporting structure. So just a side note about some oral hygiene aids, I want to talk a little bit about toothpaste. We didn't talk much at all about decay, but toothpaste really is more about carrying fluoride to the teeth, and it's a cosmetic kind of thing. It makes you feel good after you've brushed your teeth. It certainly feels, it feels clean after you've used it. But in this particular example, I'd say that's too much toothpaste on your toothbrush. Now, toothpaste, companies would probably disagree with me. But here's why I kind of point that out. Typically, when we use a lot of toothpaste, and we don't need a lot, we tend to get a lot of sudsing and foaming in the mouth. And so that causes us to kind of try to hold it in. So we, kind of try to keep it all in by our cheeks and our lips. And so next thing you know it, you have a mouthful. And so a lot of times that can cause us to discontinue our toothbrushing a little prematurely because, a couple minutes of brushing, they say, right, is really a good idea. And so, if you have a lot of suds and toothpaste in your mouth, you're going to want to spit it out and then you're finished. And that might have been 30 seconds. And so it's really important to, be able to get where the cheeks are laying against the teeth and the gum line. And so too much toothpaste really just kind of interferes with doing a really good job, I think. So if you like to use a rinse, that might make you feel like you've got some fresh, a fresher feeling after you've brushed your teeth. But also I would recommend with the mouth rinses, if dry mouth is an issue, to really look at the ingredients in the rinse, because a lot of alcohol in the rinses will exacerbate dry mouth. So, you kind of want to pay attention to the ingredients of the products that you're using. But again, not to get bogged down on products, but I do want you to know that really the most important thing is a good toothbrush and some dental or between teeth cleaning, just disrupting that plaque and any debris that might be in there after eating. So the other part of this is getting regular professional care. Of course, a lot of times every 6 months, great idea. And depending on your situation, you might need to go in more often. It just depends on what you're dealing with. But what I would really encourage everyone to do is make sure that you're finding out about what your periodontal condition is, because we can get really comfortable just getting our appointments in and not really getting any feedback on how we're doing. So I would encourage that if you are at an appointment, to ask, what are my periodontal measurements? What are my probing depths? Can you tell me how are my probing depths? And tell me about the health of the bone that's supporting my teeth. The probing depths can be done at the chair, right? At your exam, they will be able to tell you 2, 3, 4, how many millimeters they're measuring. And then an X-ray is certainly going to tell them the level of bone that's supporting the tooth. So be informed, because that is knowing your risk for periodontal disease. And it's feedback on how you're doing with taking care of that aspect of your health. And finally, if you are recommended any type of periodontal treatments, which is often a deeper cleaning, if you will, so that this hardened plaque can be removed, so that this tissue can heal, then by all means, take those steps. Because once periodontal disease has been treated and you keep your oral hygiene and you take care of it over time, you likely will not have it return. And so getting the periodontal condition managed at an early time, if there is maybe a diagnosis of Alzheimer's, get those treatments done early so that you can set up for the best possible health that reduces chronic inflammation in the mouth. Other oral care considerations for providing oral care, if you are helping partner someone with their oral care, of course, maintaining independence as much as possible, prompting so that there's a reminder helping with that, breaking down the tasks to the process, but also making sure that there's a routine that's been established or is trying to be established, and keeping things familiar as much as possible. You know, sometimes introducing new aids may not be very feasible. So go with what works. If it's just the toothbrush that works, then that's what we go with. And kind of partnering in that process, helping each other, you know, helping out with that. Keeping in mind dexterity, sometimes fine motor skills are going to be an issue. And so we want to, you know, kind of find what works. And sometimes that's working with your dental professional or other members of your care team, like occupational therapy. They know how to, you know, make special handles and make things work better. And so we want to work with them. And also considering space and time where the oral hygiene is taking place. And sometimes bathrooms are not always going to work for getting that oral hygiene done. And also the time of day. It's great to do it first thing in the morning or at night, because like I said, getting it once in a 24-hour period is really key. So if it's just once a day, that's all that's happening, at least that's what we want. And so if we can do more, that's great. If it needs to happen in shorter spurts of time, that's great too, if focus is a problem or a concern. And so, you know, periodontal disease is not going to develop overnight. So, you know, if it's not working today, try it again tomorrow. You'll get a do-over. So I think basically from today, I wanted to create an awareness about what, you know, what this connection can and is being studied, you know, what it can be and what's being studied. And also just having knowledge about what periodontal disease is and knowing the impact on our body and our brain. And then also, I just really encourage asking questions of your dental care provider, because it really is important to know what your periodontal condition is so that you can take action. And so they will be happy to talk with you about that. You know, everybody gets busy and, you know, schedules are being kept, but there's always time for education. And so ask those questions about your condition, get the treatment done, and you know, seek support from the dental care professional and from your care team, because everybody wants to have, you know, you have the best health possible, and that's, you know, accomplished by working together. And I guess finally, you know, just knowing what's going on in the research, and also understanding the stress and the chronic infection that is associated with periodontal disease, and that taking action is really important. And for those of you who like to do a little research on your own, I've just listed, you know, some .govs and .orgs that can provide some more information about some of this relationship with periodontal disease. And, I say stay informed, keep hearing more about the research, but I think we're pretty, we can pretty much say that that mouth and our periodontal condition is definitely connected to our brain body health. And so I hope that, this gives you some information you can take away and use today. So thank you. Thanks for your time.
Oh my goodness, Valerie, such a beautiful photo of sunflowers. Thank you, and such an informative presentation about something I think a lot of us take for granted or didn't necessarily know was so meaningful in terms of our brain health. So thank you. There were a couple of questions in the chat that I hope you can answer quickly. One is, what about a water pick? Is a water pick better than flossing? So
Okay.
go ahead and answer that one, and then we'll get to the next one. Thank you.
Sure. Yeah, great. So it's a great question. Water pick is certainly effective for removing kind of the larger, food particles, things like that, are kind of getting in the mouth like that. People with braces, we really recommend water picks. But for really getting off that sticky plaque, the key is really, trying to use something that's a little bit more mechanical than a water pick. Not saying it shouldn't be used. It's certainly a great adjunct. And if it's the only thing that's working, then by all means, use that. Sometimes there can be the addition of like a special rinse that maybe is prescribed like for antibacterial or antimicrobial purposes. So definitely, great question.
Okay. And then we have from Diana, what is the best way to brush? Back and forth, circular, from the gum line to the edge of the teeth? Sounds like Diana wants to know some specifics here about which way to go.
Right. So first of all, that's another great question because we hear lots of ways to do it. Any which way. I think, as I was saying earlier, though, I think that really getting at the gum line is super important, but you also don't want to create damage to the gum tissue because it is, pretty thin and delicate. And so you want to clean at the gum line, but you don't want to scrub at the gum line. And so, getting around that area is super important. But the floss is really going to get between the teeth, or toothpicks, some type of pick, that is on the market. So, yeah. And I would say ask your professional, because sometimes if you have recession in certain areas or you have special considerations, whatever restorations you may have, fillings, crowns, bridges, they can help you with that too.
Awesome. Well, my goodness, thank you, Valerie. We have had 2 weeks in a row of talking about how all of our systems are reliant upon each other. And so thank you so much for bringing us this great information about how to provide good dental care so that our brains can stay healthy. Also our hearts. I believe there's also, as you mentioned, some connections between heart health and brain health and dental health. So take care of all of it, folks. Thank you for being here. Valerie, I hope you saw the comment from Michael that says, as the son and brother of dentists, this was excellent information and right on. So you've been endorsed by a dental family. And thank you, everyone. We have one more webinar for 2023. I can hardly believe it. And that will be next Thursday, the 14th of December. Our speaker will be Dr. Autumn Brubaker, and she will be talking about advanced care planning, which is an important topic, timely, something a lot of us might say, oh, I don't really want to think about, but it is so important to have those conversations. So Dr. Brubaker will be with us next Thursday to talk about advanced care planning. And then we'll take a couple of weeks of a break. We'll miss you, but we know folks are going to be spending time with families and doing all that kind of stuff. And we'll be back in January, but we'll talk about that part later. In the meantime, stay tuned for your My Alliance newsletter on Monday, the 11th. And enjoy this unseasonably nice weather, at least here in Kansas City. The snow might be here before too long. Maybe there are some of you who like that. If you do, fine. And if you have questions or comments, please reach out to My Alliance at kumc.edu. Valerie, thank you again for enlightening us. And I think toothbrush sales are going to increase because of you. So good job. Thank you again, everyone. Cheryl says, thank you for such a great explanation. I agree entirely. All right, everybody, have a great rest of your afternoon. We'll see you next week. Bye-bye.